I'll get us going. Still have some people coming on, so I'll give you a couple quick updates and things before we get started. But this is Ed Crow. Thanks for joining me today. Today we're going to go over getting started with Medicare sales. So just to give you the idea of the theme here, it's for people that are fairly new or maybe looking for some new ideas in the business. People who are in the process of getting contracted and certified, even for people maybe who are just thinking about selling Medicare. What we're going to focus on today is a way to start generating sales quickly. So things that aren't that involved and that don't have a lot of ramp up time. The more complicated ways to generate Medicare sales and leads, I will mention some of them in this webinar, but I'm not going to get into details. Those almost would be their own webinar each. So today we're going to do kind of the quick hitter list to get started. A couple quick things. If you haven't done webinars with me before, I keep them around 15 minutes usually. Try not to go much longer than that. I do record all of them. So for future reference, if you're watching or want to watch, you get our invite and want to watch a webinar, but you can't make it, just register and I'll send you the recording. So even if you don't attend, if you just want to register and watch it later on, just register and you'll get the recording and you can watch it when you want. We usually send the recording the following day. Also, if you have questions, I will answer them at the end. Just send them into the webinar. There's the question section where you can pose a question. I'll try to answer them for you at the end. And I think that's it. Having said that, I think I'll get us started. I have 102, so we'll get going. So today, I'm going to talk about phone lists. We'll talk about access to a book of business if you're lucky enough to have access to one, or if you want to try to find one. We'll talk about that. Medicare with people you know. Get into that. A little different than life insurance or annuity or other types of sales. Current clients or past clients from any other career or line of business you wrote. Telesales leads, retail, and then just pointers, things that I sold Medicare for a long time, and there certainly are things that I really wish I had done along the way that I wound up, once I figured it out, I did them later on. But if you can do them from the beginning, you'll write a lot more business over time because of it. So I left a lot of business on the table over the years, just simply not knowing better. So we'll hit on some of those things. And then I'll probably at the end mention some of the more complex strategies you can use. I won't get into the details because they would probably take 15, 20 minutes for just each one. But I'll mention them. So we'll start with phone lists. Some people actually call phone lists. You can make cold calls off lists for Medicare supplements. You can't cold call for Medicare Advantage and PDP, but you certainly can do it for supplements. Some agents do it. There's a big population out there that do. We can provide you lists at no cost. By the way, other companies who sell lists will say, well, our list is better. It's not. They're all coming from one of three national carriers in databases. Lists are lists. They all originate from Data USA or one of their two competing companies. So we can run those lists at no cost. If you wanted a list, you would just email Teal at our office, and it's just like my email, but it's Teal, like the color, Teal, at crowandassociates.com. So you could just call us or email Teal, let her know you want a list. She's going to ask you a couple things. What age range? Do you want an income range? In what area do you want the list for? So we can run it. We can't run you a national list. You got to be state specific. We have a service we pay for that allows us from Data USA that allows us to run these lists, but we can only spit out so many, but it's quite a few records. I mean, we can spit out, I think, like up to 5,000 records at a time. So certainly can keep you good with lists, and you don't have to pay for them because we already do. So the list you get from us would be DNC compliant. Again, as I mentioned, you can cold call for Medicare supplements only. You cannot cold call for Advantage or PDP plans. So the question comes up a lot, well, what if I'm going through my list, talking to people about supplements, and as you'll find as you get into this, most people don't know the difference, consumers that is, don't know the difference between a supplement versus an Advantage. And if you're talking to them and they say, well, I want to talk about the Joe Namath plan or a zero premium plan, or I was interested in dental or vision, you would say to them, well, that's a Medicare Advantage plan. You can use Connect for Medicare or Sunfire to email or text them a scope, have them complete the scope, and then you can move on with your meeting and talk about Advantage plans. You don't have to reset another appointment. You just got to get the assigned scope, and then you can talk about Advantage plans. Just be careful about one thing. If you're cold calling for supplements, don't bait and switch. Bait and switch would mean you cold call them and you pretend like you're calling about supplements, but then you ask leading questions about Advantage plans. So like, you got to let them bring it up. You can't be the one bringing it up. So as you're talking about subs, when they bring up something affiliated with an Advantage plan, that's fine. Just tell them you need to get a scope, get the scope, and then continue on. But again, we can provide those lists to you at no cost. Getting into the details of, do you want to use a Predictive Dialer or something such as that? Well, I've used all those things. Predictive Dialers are legal. Robo-dialers are not, but predictives are. I can definitely talk to you about that. If you get into the cold calling on lists, that is something that a dialer would certainly increase your ability to make calls per hour. Another quick way is access to a book of business. So maybe you, in a past career, had something where you sold, who knows what it was. Maybe it was, it could have been anything. But if you have a list of existing clients or a list of past clients, you can prospect that list. This is Medicare, remember. It's not life insurance or long-term care. People are much more willing to talk about Medicare than they are any other line of business. In calling existing clients from a book, or maybe somebody who has a book, is way easier than working any kind of lead, especially if there's a familiarity there. We have a lot of agents that get relationships with P&C agencies that don't want to do, the P&C agency doesn't want to do Medicare. These agents get in with them. They have the P&C agents send them the referrals from the book. Sometimes when they're lucky, they even let the P&C agents solicit the book, or they'll do it for them. And if you can get access to that, that is a very good way to generate clients, a very inexpensive way to do it as well. And what I would say is, if you get an agency like that, a health agency, P&C agency, an accountant, whoever it is, make sure you tell them you'll pay them a referral fee. And you can pay them up to $100 per case. So for every Advantage and supplement you close, give them $100. Some people might say, well, that's expensive, but put it in perspective. On average, agents and insurance companies spend about $125 per acquisition selling Medicare. And that's working leads where you're cold calling and getting stood up at the door and all those kind of things. If you can give somebody to give you a warm referral from their book of business, or you can access their book of business, it's worth $100 a case, trust me. And that's $100 initially. You're going to make the money initially, but you're going to make even more on the renewals. So you take that all day long. If you have questions about that, certainly just give me a call. I mentioned this earlier, but people so I come from a background of a lot of insurance, but I started off at John Hancock, and they always would say to me, get a list of your friends and family. And it's different when you're trying to solicit a product like a life insurance product with friends and family, that they feel kind of that you're, maybe infringing upon them in that case. But with Medicare, that's not the case. I mean, people with Medicare, they're usually confused about Medicare. Most times people have a plan and they don't even know why. So if you can offer a service where you're going to show them something, maybe a lower cost supplement, or show them a better Advantage plan, or maybe show them an Advantage plan, that's usually, people welcome that, and they don't feel you're imposing when you do that. I do see we have a couple hands raised. I will certainly answer questions at the end of the webinar. I would just suggest just send the questions into the webinar, and I will answer them at the end for you. To be quite honest, I don't even know how to do the hand raised thing. I should probably figure that out one of these days. But anyway, working with people is certainly a great way, because you can help clarify it for them, and you can probably save them money. So it's not like I said, it's not like an emotional sale with a life product where you're trying to convince them to buy something and they're not sure if they need it or not. This is something they already have. It's like shopping P&C insurance. All right, so past clients from something you used to do, that's a big one. Doesn't matter really what it was. If you have lists or have information on past clients, you can call the ones that are over 65. You can call the ones that are turning 65. It's an opportunity to educate them on Medicare and pick up, a new sale and save them some money in the process. If you are lucky enough to have a list of people and their dates of birth, or you know about when they're turning 65, I strongly recommend you put them in your calendar, even if they're turning 65 5 years from now. Time flies, you'd be surprised. Put them in your calendar and call them 4 to 6 months before they're 65. The reason you want to do that is they can do something or make a decision 3 months before. So you want to get them ahead of time. Put them in your calendar. I recommend 6 months. I like 6. That's about when they're going to start getting all the junk in the mail that they get. For those not aware, when somebody now turns 65, about 6 months out from turning 65, they get heavily solicited with a lot of mail, phone calls for supplements, all kinds of stuff. So if you know when they're turning 65 and they know you through some commonality, call them 6 months before. I get a lot of people who say, well, I'll send letters. If you want to send a letter, that's wonderful, but you need to make the phone call too. So most people, when they're turning 65, are completely confused. A lot of times they don't even know how to enroll in Medicare. Sometimes they don't know that, usually, in fact, they don't know the difference between Advantage and Supplement. You can really clarify things for them and make them happy and offer them a really good service. Just to go back for a minute, I, for years, was in sales with insurance of various kinds. I didn't keep dates of birth. Had I put all those people in my calendar to call them, past clients of mine, to call them when they were turning 65, I would have written a lot more Medicare plans. I wrote a lot as it was, but I would have certainly been way more efficient and have written more had I had all those dates of birth. I did do that later in my career, and I had it so my calendar was loaded up with hundreds of people turning 65 in the next couple of years in my calendar. So every week I'd get to the office, I'd look, and I'd have 1 or 2 or sometimes 3 people that were 6 months from turning 65 I'd give a phone call to, and I closed a high percentage of those cases, much higher than I ever did from leads. Telesales Leads, this is a popular one lately. We can give you access to Telesales Leads. We have a company that does them for $10 per exclusive lead, so they're not shared. They're just sent to you. This is the quickest way to get started. You can put in an order with the company. They'll turn it around in about a week. And what they do is they're supplement calls, so they'll call the people for a supplement. Most of Telesales Leads, no matter what company you use, it's almost always going to be dual eligibles. People interested in an Advantage plan or a dual, but just follow your process. It's a sup call. You call them, talk to them. Once you determine that it is a Medicare Advantage plan that they want, that's what they're asking about, you get the scope, or you set an appointment if you're meeting them face-to-face. If you're doing it by phone, you get the scope, over the phone, or if you want to set an appointment, you can do face-to-face scopes now, so you don't have to get the scope ahead of time. So if you're going to meet with them, just get the scope before you start your meeting when you meet with them. But anyway, these leads are $10. They're exclusive. What happens is the company, they provide all the lists, everything. You just tell them where you want leads from. They'll charge you $10 a piece, minimum order of 20. Pick the age, the demographics. They'll make the call. They'll ask 4 questions to qualify the person. They'll ask them if they want an agent to call them back. If they say yes, they record it. They send the recording to you same day, and you can listen to the recording and then make the phone call. So they're quick and they're easy to get started and they work. We're seeing about a 15% close rate on these leads, which is good for Telesales Leads. You can also use our lead program to offset the cost of this. So if you don't know about our lead program, we can send you information on it. There's no minimum to start with it. You just have to have your insurance carriers for Medicare with us. And if you do, you can use the lead program. That'll reimburse you up to $500 a month. So under this setup, you could order 50 leads a month, and they wouldn't cost you anything. As I mentioned before, these leads are for Medicare supplements, but most of them will be dual candidates. If you want to get started on this program, you call our office or you'd email Lisa at crowandassociates.com. And I'm kind of talking out of order on my bullet points here, but avoid the bait and switch, like I was saying earlier. It's a sup lead. Talk to them about supplements. Wait for them to bring up Advantage plan. Then say, okay, that's an Advantage plan or PDP. Let's get a scope, text it to them, or set a face-to-face appointment and say, let's talk about this in person. And then when you get there, get the scope. I should mention briefly, this company, same company, also does $15 live transfers. So as opposed to you getting the recording of the conversation they had with the client, the prospect that day, they'll also do live transfers where you pay $15. They'll they'll talk to them, ask them the same questions, but then transfer them live over to your phone. The idea is the live transfers are 15 apiece. The idea is that they'll work better. We've found they come out closing percentages fairly similar to the callbacks. So everything being equal, people seem better off going with the $10 versus the $15, but that's just my suggestion. You could try both. Retail is a really good option for newer people. Retail locations did almost counterintuitive. You'd think with COVID they didn't do well, but they actually did great. This was the best retail year we ever had. I think it makes sense, though, because a lot of people aren't getting out as much because of COVID, but they're still going to Walmart or CVS. They're still going to their pharmacy or to the stores they have to go to. So retail, I think, as opposed to those people having already been to seminars or going to see somebody else, they kind of see that as an opportunity to talk to somebody since they're there. So retail did really well this year. Can be very productive for you. It's very productive for a lot of agencies and agents we have, and there's very little cost for it. Walmart's cost money. Walmart costs $500. If you do your reporting, they give you $250 of that back, so ultimately $250. You could co-op a store with another agent, but CVS's and Walgreens, they're free. They cost nothing. So you can get into the store at no cost and start getting yourself some opportunities. Retail needs to be done correctly. You got to put effort into it. Best thing I can say there is think outside the box. Like the people that do best at retail, they will have a lot of giveaways. They'll buy them all right at the store where they're doing the location. So the giveaways on their table they bought there. They'll talk to the pharmacy. They'll talk to the store manager. Maybe they'll do a pizza party for the employees. I mean, they think outside of the box. They get it so they even get so employees in the pharmacy are referring people to them, the ones that do it well. Most for retail locations can be a little confusing, but Walmart's are a specific program. You'd have to call us if you want to get your name on a list for a Walmart. It's pretty competitive to get Walmart's. There's a lot of agents that bid for them every year, especially after this year. But that's what you would do. You'd let us know. For CVS's and Walgreens, you do that through your broker manager. So every insurance company has a broker manager for a given area that works with independent agents. We could give you the name and number, even do an warm intro for you. And those are the people. So, for example, like the Aetna rep or the United rep are the people that control their pharmacy retail locations. And they're just going to put people in the store that they think will do a good job and that know what they're doing and people who they think are an advocate for their company. So if you have interest in that, certainly just give us a call. A couple other quick things that I didn't do early on that I really regretted is a referral gift. People all the time tell me to do referral gifts. I thought it was corny and wouldn't work. Finally gave in and started doing it, and it worked. It doubled my referrals. I started off giving a $15 gift, but I realized it didn't make a difference. So I wound up at $10. It's really more just the thought that counts. You could do a Dunkin' Donuts card, a Starbucks card, think of something completely unique. But it's just the acknowledgement. And the rules used to make it so you couldn't solicit referrals in sales or with prospective clients. You can now. You can come right out and tell them. I give referral gifts, so if you know people who are interested in talking, please, have them talk to me. I'd be happy to send you referral gifts for every referral I get that's a legitimate referral. The way I did it was, I know some agents didn't give the referral gift unless they made a sale. As long as it was a legit referral, whether I made a sale or not, I sent the gift out. And I found over time it made a huge difference for me. Spouses is a big one. I, for years, wrote Medicare plans, and I would assume the spouse would call me. So if they had a younger spouse, maybe let's say 2 years younger, 3, 4, 5 years younger, whatever, I would assume, since I knew the husband or wife really well, that the spouse would call me. And when we really looked at the information, they did call me, but only about 20% of the time. So what I started doing is diligently, every person I met, I'd put their spouse, I'd get their date of birth and put them in my calendar to call them 5 months, 4 to 6, whatever you prefer, but to call them before they turn 65. I would close 90-some% of those cases versus just hoping they called me where only 25, that only happened 25% of the time. So put spouses' dates of birth in your calendar and call them. Another big one for me, I would have a meeting for a sale with a prospect for whatever reason. Maybe they were happy with their existing plan. Maybe they had a supplement. They wanted to keep a supplement and I couldn't beat the rate. And I just kind of give up on it. And what I really should have done is kept track of those people, had a conversation with them about, all right, you're happy with what you have. However, these plans, the supplements can have rate increases in January. The Advantage plans will most likely change. Your benefits, the same company won't be competitive every year. I'll give you a call during OEP, or let's set something right now for OEP so we can review this again, and you'll definitely pick up more sales that way. Just the other thing I want to mention is, regardless, when it's Medicare, whoever you talk to is a candidate for Medicare, especially if they're in the age range. So anybody you speak with, it's not like pitching life insurance. It's something where you can help them, educate them, and if you provide them information and help them along the way, when it gets time for them 3 months out from turning 65 to make a decision, you want to be the one that they want to talk to. There are a lot of other ways to work leads. I mean, there's a ton, but they take longer and they're a more complicated setup. So examples, online leads. Online leads can work really well, but they are difficult and they got to be set up right. There's a million online lead vendors out there where you can buy an online lead. If you really work on them on the price point, you can get around $8 or $9. You got to be set up to do that. If you're going to work online leads, remember those, if you're buying shared leads, which most of them are, those leads are going out to 7 agents at the same time. It is of just the highest importance that when you call an online lead that you're the first one to contact them. And remember, some of the agents you're working against that are getting that same lead, they're going to have that lead, so it's going into their CRM and it's automatically dialing that on their phone the second it hits. So online leads, you need a CRM, you need the system for it, you got to be set up. If you are, it'll work. If you just try to do online leads and just, when the lead comes into your email, you try calling the people, it's too late, it's probably not going to work well for you. We have modules on this, we have strategies on doing online leads. Certainly call us and we can work on that with you. But you need to take some time and get set up correctly to be successful with them. Mailers, same thing. Mailers can be a really good long-term strategy, but a couple things with mailers. They take time to get back. So you put in a mail order, 1,000 mailers, you got to hope you get a good, decent response. And remember, you're going to be 3-4 weeks before you get them back. So mailers take time. There's different types of mailers, different strategies with mailers. We have a lot of agents that do them. Be happy to talk to you about the details with that and the way you could set up a mailer campaign to make it work the best. A lot of people doing Facebook ads these days. They can work really well, and they actually can have a pretty short turnaround time. But there's a lot of trial and error with Facebook ads. If you do a campaign, you can wind up spending a lot of money and not getting much from it. I won't get into a lot of detail here, but certainly could talk to people about that. I'll probably do a webinar just about Facebook ads. Just the keys really are keeping them local. The tendency is people want to do, I'm going to do a Facebook ad for 8 states. You should probably keep it local. Works better. And also keep the ad incredibly simple, way more simple than you would think. Most of the Facebook ads that don't work that I see are ones that have a lot of good information, but people just don't have the attention span for it. The ones that do well are really simple. Maybe they're saying, hey, there's over-the-counter benefits you can get. You can get non-prescription medication. You can get vitamins. You can get all these things. There's plans providing them. Or maybe they're pitching dental or vision, but they're keeping it really simple. That's the strategy with Facebook ads. Anyhow, we can definitely talk about that one-on-one or specifically, and I'll probably do a future webinar on that as well. SEO on websites. So for those who don't know what I'm talking about, meaning what I mean is using a website to get organic search from consumers going on your site. It's a long-term, can be a great strategy, but it is long-term. It takes a long time to set up so it goes well. And it can be expensive. Doing it right can be very expensive. Crow and Associates, we recruit agents completely with SEO, so web search. We know how to do it. Again, that might be another future webinar as well. But if you think you're going to just put up a website and you're just going to generate consumer traffic, just by having the website up, it won't work. A site certainly is helpful. It gives you credibility. When you talk to a prospect, you can say, hey, check out my site, and have them go on, and it gives you a sense of legitimacy with them. But as far as getting you prospects, it's not going to do it by itself. You would need to work on the SEO so you can get a good organic search results, and it would work then. Be happy to talk to you more about websites. But again, they're good for solidifying a sale. It's much harder to use a website to generate actual leads. Okay, like I said, I wanted to keep that quick, just give you a quick run through. I went over a little bit. If you have questions, just please send them into the webinar. I'm going to look here in a second to see if we have any. Remember that we have our lead program. Lead costs for Medicare can be submitted to our lead program. It's 100% reimbursement up to $500 a month. Everybody that registered for this webinar, I'll send you the recording. If you can't make future webinars, but you're interested in them, just register. You'll get the recording. We have a webinar tomorrow at 1 o'clock. That's going to focus on, once you have a prospect that wants you to enroll them, it's going to focus on the strategies to enroll them. So using the quote site to quote and compare plans, using online enrollment through Connect for Medicare and Sunfire, and accessing, submitting paper applications, and a couple kind of tricks of the trade with that as well. So that's what we're going to focus on tomorrow. Let's see if we have any questions. Okay, so questions. Let's see. So the first one is, do the lists have email addresses? The call lists do not. So the call lists are going to, well, I shouldn't say that. It won't have many. The call lists are going to be phone numbers and addresses. You can buy client email addresses. You're allowed to cold email for Advantage and Part D now. There was a rule change in 2020. Again, that's a little involved, but basically, companies will sell consumer email lists that you can buy. There's a couple of strategies you'll want to do with that. You don't want to send mass consumer emails, prospecting emails from your own email. You want to use a constant contact, campaigner, SendGrid. You want to use a vendor for that, and you want to use a different email address. I can give you details, because if you use your own, it's going to get identified as a spamming address, and you're going to go into a lot of people's spam. But yes, the call lists do not have email addresses, but you can buy separate emails. Good question. Question regarding the scope. If the client signs a scope, does this indemnify you from the bait and switch you talked about? No, it doesn't indemnify you. I mean, you still have to be careful there. Getting a scope covers you, yes. So, you got a scope, you're then allowed to talk to them about Advantage plans, Part D. However, you got to keep in mind, when you're calling them, again, the basic rule here to follow is, if you're calling a telesales lead, talk supplements, more likely than not, they will bring up something about an Advantage plan sooner or later, whether they say zero premium plan or what about the plans I hear about on TV that give you dental and vision. That's your opening. Then you can say that's an Advantage plan. Let's have you sign a scope, and you'll be absolutely fine there. Another question, any info or insight into CRM systems? Sure. I mean, there are a lot of them. There's a ton. I mean, I have people who use all different ones. Some people use Zoho. The one called, I keep always saying Next Level, but it's Go High Level is one. So Zoho, Go High Level. I know Pinnacle offers Agency Block for like $10 a month, so that's very cheap. I use Blitz, B-L-I-T-Z, in my office. Blitz is pretty good as a lead manager. It's pretty good as a CRM, but there certainly are a lot. Those are a few I mentioned. If you want a basic CRM, the Pinnacle one's your cheapest way to go at $10. And what's nice about Agency Block that Pinnacle offers is any applications you submit through Connect for Medicare, Sunfire, or paper applications that Pinnacle processes for you, they're automatically loaded to the CRM, which is a nice advantage. If you want something that's going to manage online leads and get really sophisticated with auto dial and stuff like that, then you'd want like Go High Level, Zoho, Salesforce, but that's pretty expensive. Blitz isn't bad. Those are ones you'd want. They're a little more sophisticated. Agency Block they have a more sophisticated version of it, but that's a little more expensive. I think it's like $50, but still a pretty decent price compared to a lot of them. Any other questions? Let's see. Those are the three I had. Let's see. Oh, but I think I do have a couple more. Hang on. So that question. Okay, so the question is, I've used the Aetna phone scope for the first time in the last week, which is great because sometimes the senior has no email or cell phone. Does United have a phone scope? What about other carriers? United, I don't believe right now has a phone scope. Other carriers certainly do. It's different per carrier, but there are multiple carriers that do have phone scopes, yes. I don't think United has one currently. I hope I'm not misspeaking by saying that, but I don't think they do. But yeah, I agree with you. If you're talking to a prospect that doesn't have text or email, then a phone scope makes a lot of sense. Again, if this is something, if you are comfortable with it, you also could meet them too. If they're willing to meet, then you can get the scope at the meeting. So that's an option as well. I know with COVID and stuff, there's concerns there, but I just wanted to mention it. How much does it cost to be at Walmart? Okay, good question. Walmart costs $500. However, you get $250 of it back if you do the basic reporting that they ask for. So, in other words, $250. Walmart has a 20-hour minimum requirement at the store per week, so I get a lot of agents that will split the store with somebody else, and then it's splitting your cost as well. Yes, I got asked again, is it $500? Yes, it's $500, but you get $250 back once you do the reporting. So really, it's $250 is how much it costs. See if we have any other questions. Those are good questions. Let's see. That looks to be it. Certainly, if you have other questions that come up later on when you're thinking about it, give us a call. I'll be happy to answer them for you. I have one more question. So when does the Walmart program start up again? I should have mentioned that, and that's a really good point. So Walmarts are for AEP and OEP. However, the bidding process starts in about a month. That's how competitive it is. So if you want a Walmart, you'd email Lisa at my office or call here. We'd have to put that in for you. You'd let us know, I want a Walmart in this area. What we're going to do is once Walmart releases the lists, we'll say, okay, in that area there's 2 stores or 3, or 4 or 5, depending on how big of an area you give. Give us your top 3 choices, and then you hope on the bidding process you win one of the top 3. Once you're in the store, every year they give you the right of first refusal with that store. So once you're in, you can keep it. But getting it initially is a bid process. You're up against a lot of people, but it's certainly worth trying to get one because they do work very well. All right, looks like that's it for now. So I don't see any other questions. So I appreciate everybody coming on today, and I hope you have a great day. And again, we'll send this recording out. So thank you. Appreciate your attendance. Call with any questions, and have a great day.